Hello, everyone. My name is Dr. Anuli Njoku. I am an associate professor in the Department of Public Health at Southern Connecticut State University. It is my pleasure to speak to you today for this keynote presentation. I would like to thank the Healthcare and Biological Sciences Research Association for the invitation to speak today. My presentation focuses on nutrition and health in the USA. Here are some questions this presentation aims to address. Why is good nutrition important? What factors influence people's eating patterns, and how are these eating patterns related to health? What is the link between nutrition and disease in the USA? What efforts exist to promote healthy eating? What are some evidence-based health and nutrition tips? So why is good nutrition important? Your food choices each day affect your health, how you feel today, tomorrow, and in the future. Good nutrition is an important part of leading a healthy lifestyle. Along with physical activity, your diet can help you to reach and maintain a healthy weight, reduce your risk of chronic diseases like heart disease and cancer, and promote your overall health. Nutrition-related risk factors are linked to major health risks, illnesses, and death due to hypertension or high blood pressure, high blood glucose, overweight, obesity, high blood cholesterol, type 2 diabetes, cancer, and others. Poor nutrition burdens the U.S. health system. Obesity can cost the U.S. healthcare system as much as $245 billion a year, so this is definitely a pertinent issue. Furthermore, you can see in this slide that according to recent statistics in the year 2017 from the Centers for Disease Control and Prevention in Atlanta, USA, 5 out of 10 leading causes of death in the U.S. were nutrition related. Furthermore, the top 2 causes of death in the United States are nutrition related. So you can see highlighted heart disease, cancer, stroke, diabetes, and kidney disease are among 5 of the top 10 leading causes of death, which are nutrition related. Various factors influence eating behaviors, such as taste. Studies have shown that taste is U.S. Americans' #1 consideration when making food purchasing choices and decisions. Research shows that humans have biological preferences towards food that is sweet and fatty. Emotions drive food choice as well. Increased stress is linked to craving and eating foods high in calories, sugar, and fat. Price is an important factor for food in almost 80% of food choices in the USA. With convenience, our fast-paced society increasingly requires adults to work outside the home and creates a demand for quick, accessible, easy-to-make, affordable meals. So with health and nutrition, many consumers want foods that will help them improve their physical health and lose weight and manage health conditions. When consumers read food labels, they tend to notice information about calories, fat, sugar, and sodium. Food manufacturers respond to this by creating a variety of food options labeled as having low fat, sugar, and sodium, and these foods tend to be processed and are less healthy than they appear. Regarding culture and familiarity, if you think back to foods you loved as a child, you may be flooded with powerful memories. Many people have strong connections to foods native to their culture and upbringing. Regarding environment, foods that are readily available to consumers affect their food selection. If you live in an area that lacks access to foods found in a grocery store, your diet will reflect this. Marketing is another factor that affects eating behaviors. Food marketing and packaging influences food selection, and there is especially a concern regarding the effect of marketing towards children, as it could have shaped their eating behaviors that carry into adolescence and adulthood. So therefore, all of these factors affect eating behaviors and an individual's risk for chronic health conditions such as heart disease, diabetes, and cancer. To address eating behaviors, an ecological approach is needed. An ecological approach examines the interaction between humans and their environments. This approach can help increase personal motivation while creating environments and policies that facilitate healthier choices. To involve change through different spheres to influence motivation, you need to look at change at the different levels, such as individual, family, school, workplace, community, as well as at the policy level and making policy changes. The dietary guidelines for Americans are nutrition guidelines jointly issued and updated every 5 years by the U.S. Department of Health and Human Services. as well as the U.S. Department of Agriculture, and it gives advice for Americans ages 2 and older about consuming fewer calories, making informed food choices, and being physically active. These guidelines encourage habits to maintain healthy weight, reduce disease risk, and promote overall health. In 2011, the U.S. Department of Agriculture eliminated the food pyramid and introduced a My Plate to encourage Americans to increase intake of certain foods and decrease intake of others. Dietary guidelines for Americans' key recommendations include follow a healthy eating pattern across the lifespan. So follow a healthy eating pattern over time to maintain a healthy body weight and reduce risk of chronic disease. You want to focus on nutrient-dense foods and beverages, meaning foods and beverages that provide vitamins, minerals, and other substances that contribute to adequate nutrient intakes or may have positive health effects with little or no solid fats and added sugars, refined starches, and sodium. Another recommendation is to focus on variety, nutrient density, and amount. Therefore, choose a variety of nutrient-dense foods and within all food groups in recommended amounts. You want to limit calories from added sugars and saturated fats and reduce sodium intake. Therefore, consume an eating pattern low in added sugars, saturated fats, and sodium. So you would like to limit things such as sodas, packaged desserts, burgers, pizza, and ice cream. An example of a common added sugar is high fructose corn syrup. You also want to shift to healthier food and beverage choices. Here you would replace typical food and beverage choices with more nutrient-dense options. So for example, if you like pasta with vegetables and sauce, you would reduce the amount of sauce and then add plenty of vegetables to it. Another recommendation is to support healthy eating patterns for all, and this could occur in multiple settings nationwide, from homes to schools to work and to communities. This slide shows examples of nutrient-dense foods and the various health benefits the foods provide. In the previous slide, I discussed the importance of focusing on nutrient-dense foods. These are foods and beverages that provide vitamins, minerals, and other substances that contribute to adequate nutrient intakes or may have positive health effects, with little or no solid fats and added sugars, refined starches, and sodium. All vegetables, fruits, and whole grains, seafood, eggs, beans and peas, unsalted nuts and seeds, fat-free and low-fat dairy products, and lean meats and poultry, when prepared with little or no added solid fats, sugars, refined starches, and sodium, are nutrient-dense foods. The Dietary Guidelines Advisory Committee, which is responsible for reviewing all published nutrition research to advise the government on dietary recommendations, summarized several of the most common global dietary patterns and the relationships of those diets to the risk of disease. Their research review shows that certain diets and dietary patterns are linked to reductions in chronic disease risk and improved health outcomes. The typical American or Westernized diet, which is high in calories, processed foods, added sugars, solid fats, refined grains, and sodium, is associated with increased risk for obesity and several major chronic diseases. Other dietary patterns, such as Mediterranean and Asian diets, that are higher in fruits, vegetables, seafood, and whole grains are associated with lower risk of disease. In the previous slide, I discussed how increasing portion sizes can affect eating habits. This includes beverage intake as well. Calories in beverages aren't hidden as they are listed on the nutrition labels, but many people don't realize just how many beverage calories can contribute to their daily calorie intake. Shown on this slide are estimated calories from different beverages. The size of the beverage makes a big difference. Just going from a 12-ounce juice or soda to a 20-ounce drink can almost double the calories. The exception here is water and diet soda, though some diet drinks may contain a small number of calories. If you drink milk, the type of milk you drink makes a difference. An 8-ounce cup of whole milk can have 150 calories compared to 90 calories in an 8-ounce cup of fat-free milk. You have plenty of options in reducing the number of calories in what you drink. Try switching to a healthier alternative. This includes switching to a no or lower calorie alternative drink. So you could try a smaller sized coffee or cafe latte, or you could switch to water, which would be your best choice. You could save up to 200 plus calories in the process. So we've discussed a lot of information about nutrition and health, and it can be easy to get confused when it comes to facts about nutrition and health. Here are some evidence-based nutrition tips. Evidence-based means they are rigorously tested and supported by science and extensive research. Don't drink sugary drinks. This includes soda and certain juices. Sugary drinks are strongly associated with obesity, type 2 diabetes, heart disease, and many other health problems. Eat vegetables and fruits. Vegetables and fruits are loaded with many vitamins, minerals, and antioxidants, which are substances that can protect against cancer and other chronic disease. Avoid processed junk food. So, for example, packaged cakes and cookies, processed meats, and candy. Processed junk food can be low in nutrients, low in fiber, full of added sugar, and high in trans fats, which are manufactured fats. Drink water, especially before meals. Water can help increase metabolism, replace sugary drinks, and aid with weight loss. Eat enough protein. Eating enough protein is crucial for good health. Protein can boost your metabolism, make you feel full, so that you eat fewer calories, and can help reduce sugar cravings. Don't eat a lot of refined carbohydrates. So for example, white bread, white flour, white rice, many breakfast cereals, they tend to be lower in nutrients and stripped of fiber. Avoid trans fats. These are artificial fats that increase the shelf life of food. While the Food and Drug Administration mostly banned trans fats in 2018 in the USA, some foods still have them. So for example, fried fast foods in the form of partially hydrogenated oil, some microwave popcorns, bakery products such as muffins, cakes, donuts. So that's something to keep in mind. Also use plenty of herbs and spices. So for example, ginger, turmeric, which can have powerful health effects, including antioxidant effects. Track your food intake when possible. Use a nutrition tracker that lets you know exactly how many calories you eat, whether you're getting enough protein, fiber, and other macronutrients, as this has been linked to successful weight loss and sticking to a diet. To summarize, this presentation discussed the following. Good nutrition is an important part of leading a healthy lifestyle, maintaining a healthy weight, and reducing your risk of chronic diseases such as heart disease, cancer, diabetes, and stroke. Numerous factors influence people's eating patterns, and these eating patterns are related to health outcomes. There are various efforts on multiple levels of an ecological model. So for example, individual, interpersonal, community, organizational, and societal to promote healthy eating. Awareness of what is in your food, healthier alternatives, and nutrition recommendations that are supported by science can help ensure healthy eating behaviors. This slide shows the references that have been used in this presentation. This slide also shows, as a continuation, the references that were used within this presentation. I would like to thank you all for your time and attention today. I hope that you found this presentation to be informative, to be insightful, and enjoyable. Thank you for your time.